Welcome to Podcasts on Demand, a continuing medical education activity. This activity includes the most recent and current clinical data presented by leading experts. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the podcast description that can direct you to this information.
Hello, and thank you for joining us for episode 1 of 3 for this podcast series entitled Patient Voices in Primary Biliary Cholangitis, a CE podcast series to recognize challenges, reduce disparities, and improve outcomes. I'm Dr. Douglas Dieterich, Director of the Institute for Liver Medicine, the Mount Sinai Health System, and Professor of Medicine in the Division of Liver Diseases at Icahn School of Medicine at Mount Sinai. I am here with my patient, who will not be identified. So we'll ask her first, how was the diagnosis made? So prior to your PBC diagnosis, please share what symptoms you experienced and how did these impact your daily life?
Sure. I had gone for an annual physical exam and I was just fatigued a lot, but I attributed it to just working a lot of shifts. I was studying at school and I was just really tired where I'd start to eventually fall asleep as soon as I got home, like around 6:30 at night. And then when I'd wake up like the next day just to go to work, and I was like, oh gosh, this is not normal. I let my internist know, and then she called me back and said, your liver enzymes are really high. And I just thought, well, maybe it's, all right, we'll cut out alcohol or something, I was drinking socially at the time. And then she waited about another month or two and went back for tests, and the liver tests were even higher. And then that's when she said, look, you have to see a gastroenterologist, and eventually made my way to a liver specialist, which was you.
Did the gastroenterologist understand what was going on?
And that was the issue. He had told me originally, the gastroenterologist was like, all right, looks like you have some liver disease, and began, a course of prednisone and some immunosuppressants, just trying to help. And then, it was always this ALK-Phos test that seemed to be up, and it was just more attributed to, oh, it's probably just you had some fatty foods. Oh, and it kind of went that way. So that went on for a little while longer. And then eventually I heard about you and the fantastic reputation at Mount Sinai. And then that's when, it was explained to me what PBC was and the importance of ALK-Phos. And I just started to think, wow, how many other people have this and don't realize they have this? And I just felt like a lot of the healthcare world maybe doesn't understand that
Yeah,
ALK-Phos does not. Yeah.
we need more education, I think, in the GI world
Yeah.
about PBC. So did you have any other health concerns or stressors at this time?
I mean, in regards to health concerns, I had a thyroid issue, and then I just started to get worried, like, gosh, is this some autoimmune thing that's taken over my body? Am I going to have a liver transplant? Why is this thing going on? I have no control. I can't fix this. Why did this happen? Yeah, that was the more concern, was like, how is this going to affect my life? And down the road, what am I looking at? Because you go on the web and you start Googling it, and it's scary.
Dr. Google is a dangerous place to go.
It is.
Um,
It's very scary.
so during the time you were undergoing evaluation for PBC, what were you thinking other than you're going to need a liver transplant? Now, it actually makes sense that you had thyroid disease, which is an autoimmune disease,
Hmm.
because autoimmune diseases tend to occur, together. You've got that kind of a body where autoimmune things happen. So not sure.
Yeah.
There is pretty common among patients with PBC to have other autoimmune diseases like Hashimoto's thyroiditis or autoimmune
Right.
thyroiditis. Um,
Yeah.
how did you finally learn about having PBC?
Through the liver biopsy, and then I met you, and you were very thorough and went and explained all these liver tests, and it was that, and then diagnosed upon biopsy. The thing that I had hope, I guess, fed into my denial of it was when that AMA test, it seemed to be negative a lot, but I was holding on to hope, like, please don't let it be PBC. Please just let it be something weird. And unfortunately, through the biopsy and through the testing, it did. And, your experience, it was PBC. And then I
Well,
guess
I think
the
back
thing that,
then it was also called primary biliary cirrhosis, right? So
correct.
that didn't help reassure you any about your prognosis.
No, no, the stigma of cirrhosis, you hear that in there, and then you're in your mind as a patient, you're like, oh my gosh, it's going to scar, it's going to cirrhose, and then you start to think, oh gosh, what did I do to myself? You hear cirrhosis of the liver, and then people automatically think, oh, alcohol, and that wasn't the case. I mean, I didn't really drink for quite some time. Um, it was scary, and then I would I started to delve further thanks to Dr. Google, and I felt like almost like I got the middle child of liver diseases. It's like the liver disease that I felt that not many people know about, or I feel like it's not in the forefront. I'm like, where's the research? Why is everybody doing all this research on the other hepatitis that are out there? Why isn't anybody talking about PVC? And and I was like, out of all the ones to get, I had to get this one. So it's just, it's so confusing and it's scary as heck. It's always that dark cloud that's in the back of your mind day in and day out. And it's tough. It's a tough, like, albatross to have on you. And it's just the unknown of what's going to happen. It's scary.
So talk a little about your interactions with your healthcare providers during this time. Referral
Yeah.
process, the ease of access to a specialist, counseling, support.
Yeah. I mean, I think I'm lucky. I think I'm a big advocate for myself, and would speak up. So I was lucky. With with the Mount Sinai, with your team, you and your support staff, like your Allison, your nurse practitioners, your PAs. You have a good. If I can't reach you, I know one of them will get back to me within hours, which is great. Yeah, so I really appreciate the communication I have had, and that's honestly, God, that's when I started to see my view of my life get better. I had other doctors and who were awesome, but I feel like they didn't give that emotional kind of support, or like, hey, look, you got to still live your life. You still have to enjoy your life. I was like planning for my funeral, planning like, gosh, I'm gonna have to change careers because I'm gonna need a liver transplant. What am I gonna do? Or it just felt like my life was just over, and I was young. And your support staff was great. I will say the problem I have, especially now with this mail-in pharmacies and the way the insurances sometimes will say certain drugs are only covered through specialty pharmacies, that's a big challenge for a patient. I ran into just recently myself, just trying to get the medicines on time, the paperwork process. People on the other line there don't understand the franticness that a patient feels when they are not going to get their medicine on time. And it's just the paperwork, the red tape involved. That is a big dilemma for patients. And I think that has to come into consideration now as we deal more and more with these mail-in
Yeah, the
pharmacies.
PBMs are nobody's favorite. So
No.
what about treatment? What issues were on your mind when discussing starting
Mhm.
treatment? Was there a key thing that helped
Yeah.
you making your decision to start your medication?
In order to accept a pill that you're putting in your body, you're like, yes, yay, this is great. Okay, hopefully this will work, this one. But the side effects is the huge battle that almost freezes me from taking that pill. So that's the first thing, is that I'd say the side effects I felt was muscle weakness on one of the drugs. I felt so achy. And then thank God you listen, like you at least hear me and you're like, listen, we can adjust the dose there. And as soon as you lowered the dose, felt completely fine. The aches went away, and that was wonderful. And I think that is important, that you listen to the patient, listen to them, and don't sit here and cookie cutter it, where it's just like, nope, sorry, this is the dose. This is what you have to take. Tough, deal with the side effects. Or here, let me give you another pill to deal with the side effects. You actually looked and you listened and said, okay, you know what? Let me lower this, besides jamming me up with even more medicine to deal with side effects of a pill.
And what are
So
your
that's
thoughts
important.
about the impact of follow-up and monitoring tests on your daily life?
I think by having the regular checkups with you, it actually kind of keeps me in check too, because I know, all right, I'm going to see Dr. Dieterich in 2 or 3 months. Like, you're keeping an eye on me and holding me accountable to stay healthy. Because if I didn't see you for a while, who knows? Maybe I'd be like, you know what? Let me have that drink, or let me have that hamburger right now. By knowing that it's almost like drug testing, I guess. Like, when you know you're going to be going for these routine tests, you're held accountable to stay as healthy as possible as you can. Because I know if I come in there and these tests are bad because of bad nutrition or whatever, I'm like, crap, he's going to up my dose. I hate being on high doses of medicine. So, no. So I think that's also another key part of staying there. But no, yeah, it's forced me to stay healthier.
And what are your thoughts about when you had to switch to a different PBC regimen? I think which you did a
Yeah.
couple of times.
Yeah, we did. Obviously you felt my first resistance, like, I don't know, what is this pill? What, like, has it been around a long time? Is this just something that's experimental and that we're going to learn another year or two later? It's like, oops. So that's the big holdup with me, is worrying about, all right, is this proven to really work? Um, and then we had gone on one, and I thought it was great because the tests were doing great. But then when we had that MRI and it showed the hypertension, was it the portal hypertension or
Yeah.
something had evolved? And then I thought, oh man, gosh, now I got to worry about this. I didn't have to worry about this before. But then was it the drug, or is it the actual, just the process speeding up for some reason? So that was that one. And then another one, I like the recent one that we're on now at the lower dose. I feel better. I feel actually like I have more energy somehow. Like, I know my body is feeling overall better. I can now go back to running a little bit. I can go back to doing activities. But switching the drugs, it's just scary, because you're like, oh gosh, I hope that this time this one's going to work, or is this one going to make me worse?
There are there are a few new drugs on the market
Mm-hmm.
uh, as well for PBC, so we can discuss those at your next
Yeah,
visit
but
to see if you might benefit from those.
I'd say that's probably where I'm at in my life right now with this disease. Is I just feel stuck. I'm like, why can't we cure it? Why can't somebody care enough to to cure PBC? It's just like, I really feel like the media, more people need to understand what PBC is. I just don't know what the hang up is, why they can't figure
I
this one
think you're
out.
succeeding in that. Talking about it in this podcast, a lot more people will hear about it.
Yeah.
Hopefully, we'll
And
be
I
able.
hope and I hope a lot more will go get checked, and that other healthcare practitioners and professionals will say, oh gosh, that Al Cross, oh, maybe it's not some menopausal woman, and oh, that's just bone or something, or it's just you eat a fatty diet. They need to look a little bit more further, just go that extra step and make sure that there's not, because you don't want to be showing up at your door with somebody who now is at stage 3, when maybe they could have gotten caught at stage 1 and stopped it, and live a nice, long, healthy quality of life. Like, that's the key, is I just want a good quality of life. But
Has
I
your
think,
health or other health issues changed since being treated for PBC? other
I'm
than
trying to.
your level of anxiety, which was
Yeah, the
all.
level of level of anxiety is the fact that I can't control this drives me nuts. I think that's the thing. I'm like, all right, body, why are why are you doing this to the bile ducts? Um, no, I think honestly, the only thing I mean, maybe it's just my age. I just gained some weight, which I'm not happy with. But otherwise, no,
Looking back,
actually
what
just
are some of the key learning experiences in your journey with PBC and its treatment? What would you like to share with other potential PBC patients?
Mhm. I'd say to them, you know, empower yourself with really maybe finding a good diet to follow. Make sure you're with a doctor who listens to you, hears you, just can validate what you're feeling. And just you've got to take something under your control, which is just exercise. um just don't let it own you. Don't, because that was the worst. Until I met you, it had owned me. And you just can't. You have to live a life. You've got to find other activities that don't socialize around alcohol. Like I started doing improv, I started playing golf, I started doing activities that would not require people sitting around a bar talking. So it's just that was probably the toughest social battle with this. And yeah, I'd say those are the main keys. And just make sure with the medications, make sure you have a calendar, gives you ample time when you're ordering your pills. Don't wait, even a few days before. Just make sure you really stay on top of that. And I don't know, you just gotta try to somehow laugh and pray that down the road there's going to be a cure for this. Yeah.
Well, that's a perfect segue. What thoughts do you have about looking forward?
Yeah. Looking forward, I'm trying not to have that doom and gloom where if you go on the internet, you see all these people who are like, you're going to itch like mad, the itching, and also looking for signing up for finding living donors. Like, I've decided not to go that route. Instead, I'm looking forward to like, wow, like this year, there's 2 medications that are coming out this summer alone. So then I'm thinking, well, gosh, this maybe PBC is getting some traction here.
Well, I think there's always new medications coming, and new medications for autoimmune disease in
Yeah,
particular are
yeah,
are coming swiftly. So,
yeah.
in closing, we thank you for joining us and hope you come back to hear episodes 2 and 3 of this educational podcast series.
We hope you found this podcast useful and educational. To receive continuing education credit and to download your printable certificate, please go to the activity page at practice.cme.com to complete the post-test and evaluation to receive continuing education credit.